Hello. Welcome to a brand new medical surgical lesson. My name is Jessie Wheatley and I will be facilitating this lesson. Please be sure that you have your notes ready and you have your notebook and you have your textbook that accompany this lesson so that you can follow along accordingly. Thank you for listening to this lesson. This lesson covers transfusion therapy, nursing roles and responsibilities, and a review of blood components in RN consideration for the transfusion of blood products to the older adult. By the end of this lesson, you should be able to prioritize RN nursing care for patients receiving different blood components. You should be able to continue to explain the ways in which problems of hematologic system can affect many tissues and organs by interfering with oxygenation and tissue perfusion. Now, let us take a moment to review the preparation for transfusion. A physician order or a prescription specifying the type of component, the volume, and any specific conditions is needed for you to administer blood or any components of blood. A separate consent form must be obtained before a transfusion is performed. Um, you verify prescriptions for transfusion of blood products with another nurse. Use at least two forms of identification for patient who is to receive a blood product transfusion. Usually it's a name and an identification number. Remember that RN responsibilities for a transfusion. You want to make sure that whether you delegate or you do it yourself, you take vital signs and check temperature immediately before starting the transfusion. You want to use normal saline as a solution infusing with the blood products. You want to begin the infusion slowly and remain with the patient for the first 15 to 30 minutes, as severe reactions usually occur with the first 50 mLs of blood. Ask the patient to report any unusual sensations such as chills, shortness of breath, hives, or itching. Um, you want to transfuse blood products more slowly to older patients as those who have, or any patients that have a cardiac problem, and do not administer any other drugs while infusing blood products. Let's talk about different types of transfusion therapy. The first one we're going to talk about is red blood cell transfusion. This is a replacement of red blood cells lost via trauma or surgery, sometimes given to patients with problems that impair or damage their own red blood cells, so to boost the red blood cell count. Next, we quickly review platelet transfusion given to patients with platelet counts below 10,000 and thrombocytopenic patients who are actively bleeding and are scheduled for an invasive procedure. Plasma may be given to a patient to replace the blood volume. Usually, this is given as fresh frozen plasma, if FP. It is frozen right after donation, and this is what would be given to the patient. Cryoprecipitate transfusion. Cryoprecipitate is a plasma derived product. It's composing of clotting factors and fibrinogen. White blood cell transfusion or a granulocyte transfusion is more rarely seen, may be given to neutropenic patients with infections that may need white blood cell replacement transfusions. This practice is less common as a result of availability of white blood cell growth factors. Another thing we need to review is autologous blood transfusions, which involve collection and infusion of the patient's own blood, reducing compatibility issues and the risk for bloodborne diseases. Four types of autologous blood transfusions are talked about in your textbook. These in preoperative autologous blood donation, acute normovolemic hemodilution, or intraoperative autologous transfusion or post-op blood salvage. As you continue to review transfusion therapy, it's going to be important that you also revisit febrile transfusion reactions. And examples are febrile reactions, hemolytic transfusion reactions, allergic transfusion reactions, bacterial transfusion reactions, and circulatory overload. This also, you need to review transfusion associated graft versus host disease, TAGVHD, as you review uh, your notes. Thank you for listening to this lesson. I hope you've enjoyed this quick review of the transfusion therapy and nursing implications for these patients. For questions about the lessons or corresponding notes, please feel free to email me. Have a wonderful day.